So we are 3 minutes past 7. We'll give members a minute or two, and we can start at 7:05. So welcome to this evening's webinar. This is one of the webinars a series of webinars we've been having on mental health every Tuesday evening. So you're most welcome. And we'll just start by having a few of our panelists welcome us to this event. I request Dr. Tara, if you can just welcome members to this webinar. Thank you.
Well, thank you so much, Catherine, and welcome everybody to today's webinar on mental health series during this time of COVID, but I'm sure most of the people who have been participating, you've gotten even more than COVID issues coming up. So I hope the members are benefiting. This is a collaboration between KMA, I think, the NENAC and PIPAC and of course, the Kenya Clinical Officers Association. So, ladies and gentlemen, let's hope we have a nice interaction once again, like the first one that we've had. And once again, the organizers, thank you for bringing this up.
Okay. Thank you, Dr. Tara, for that welcome. Without further ado, I'll request that our speaker for today, Dr. Anne Boyle, starts the presentation. Dr. Anne Boyle is a lecturer at the University of Nairobi. She's also a clinical psychologist and also a researcher. So she wears many hats, and I would like to really welcome her to present to us a topic for today on self-care, which is a topic I'm sure she's very happy to present, considering she is involved in a research that is incorporating some of this, what she'll be talking about today. So welcome, Dr. Boyle. We are ready to hear from you.
Thank you very much, Dr. Gitao, for that introduction. And I'll go straight to the topic, and that is of self-care. Next slide, please. So the presentation will take the following structure: the definition of self-care, or a reminder of what it is and barriers to self-care, improving self-care, and the importance of self-care as health workers. Next slide, please. So what is self-care? And as I presented and thought about this topic from the time I was told to prepare, I had a number of thoughts, a number which took me back to the times I was growing up in the village to now, and tried to see and tried to look at how in the busy schedule of my mother as she brought us up, how did she take care of herself in the middle of having very many children and in the middle of all that. And I tried to see, went back, memory lane, and I was happy to get this definition by WHO, which says, which defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illnesses and disabilities with or without the support of a health provider. So individual, families, to promote health, prevent disease. So if as an individual we are promoting health, we are preventing diseases, then we are saying, and we are maintaining health, then we are saying there are certain things that we need to do as healthcare providers to be able to take care of ourselves. So next slide, please. And then if I leave that definition, then we see self-care as any activity that we deliberately do in order to take care of our mental, emotional, and physical health. And in the process, we are promoting health of ourselves. And you notice that of the people who are next to us, because if we are healthy, then we are saying that the people who are next to us are not worried about our health. Next slide, please. Now, that definition sounds very simple. But then the question is, then why do we have to take a deliberate action to remind ourselves about self-care? It's interesting because we wake up, we assume we are taking care of ourselves because we have taken a bath, we've taken breakfast, we have said good morning, and we are off to work. We have taken our family members, we have ensured they're okay. And ourselves, we have no headaches, we have no stomach aches, so we are okay. So why are we having that to think that we have to take deliberate actions to remind ourselves what self-care is? And the point is, despite being a simple concept, it is something we very often overlook, with the assumptions that I woke up, I had no headache, I took breakfast, I went to work, I greeted my friends well, then is there something we overlook? And that way we have to remind ourselves what self-care is. Next slide, please. So if it's not as simple and is not as something we overlook it, then what are the barriers to self-care? So do they relate? When we think of barriers to self-care, what is it that makes me not take care of myself the way I'm supposed to? Then do these barriers relate to time management? And one of the commonest complaints that we have is that there's no time to take care of ourselves. And that time we haven't thought of what is self-care. Maybe I've put it as this very big elephant. And so we are saying maybe there's no time. So is there a problem with that time management? Then we have to think, if it's something to do with self-care, again, is there a problem or do they relate to workload? Either as an employee, those of us who are employed, as an individual practitioner, or a combination of both. I know many who are employed, they're employees, and they are practitioners in their clinics. So does that affect, is that a barrier to our self-care? Next slide, please. We can still continue asking ourselves, Do the barriers then relate to whom we are? Do we feel guilty if we have to take care of ourselves, treat ourselves to a good laughter, sit at the sofa, put our legs up, or talk to our friends, or just go and do something for ourselves? Say no to people who really want us to do something for them, or do not seek support from family members or friends. So are those barriers to self-care related to whom I am? And maybe I can see where do I fall within that. Or do they relate to the lack of awareness? Maybe I forget that there's need to take care of myself, take care of yourself. Do we forget? Such that all that put together, you find that, well, I want to take care of myself, but there are a number of barriers, and maybe I can point them out to other people, but I'm not able to point them to myself. Next slide, please. We can also think, are these barriers, do they relate to the belief that since I'm a healthcare worker, healthcare provider, I know how to take care of my health based on my training? Is my training a hindrance to self-care? Because I know that I don't need, I know when I'm having a headache, I can quickly, and the fact that I'm able to tell others what to do, do I take that to myself? Do I make use of that myself, or I just see that it's for others? I believe that that which I know is enough, and therefore I do not need to go further to take care of myself. Next slide, please. Despite these barriers, we are saying that we do not need to be discouraged. We need to remember there's no one model of self-care for all. So maybe if it's in terms of what I need to do, as we are going to come across, I could have failed to fulfill all those others I've read, I've heard, but I did something. I need to remember that if my friends, my workmates are trying to do this as their self-care, then I do not need to worry, because if I cannot fit in their model, then I could look up and find out what model would be relevant or would fit me. The other thing important to remember is that when we integrate self-care, it should not be a stressor. It should not be something which brings us stress and we say, oh my God, on top of being employed and I have to sneak out and see these patients in the clinic, I have to take care of all this. Self-care should not be something which adds stress to our life. And what is important is just finding out what works for you, what works for me, what works for X is not what will work for me. And so I do not need to be stressed, trying to wonder what I need to do, what I need to say, no, I can find that which fits within myself, so long as it is prescribed that it takes care of me. Next slide, please. So according to the American Psychological Association, we are supposed to explore self-care that contributes to your feelings of rewarding engagement, professional and personally. That we need to explore the care that contributes to the fact that at the end of what I do to take care of myself, I feel rewarded, I feel good. And it improves me professionally and at a personal level. And if it's at a personal level, then when I'm improved at a personal level, at professional level, then it radiates to the people who live around me, my family member, and my colleagues and all that. My self-care should reflect what I'm able to do at that particular time. And also to remember, it can change depending on circumstances. For example, if I was just used to maybe jogging in the house because the environment wasn't right out and had to think of how many minutes I imagine I'm jogging, I might get a transfer and go to a place where there's a good environment, forest, paths and all that, which I can make use of. So it can change. And so on. So it's not static. It can change depending on the circumstances. And to remember that our unique self-care process is not an isolation of ongoing issues, that which I will choose as a way, or the many things that I'm going to choose to take care of myself, will not be in isolation to my life. They'll be integrated within that which I am at that particular moment. And that way I'll find that the integrating self-care is not a stressor within my life, for other people around and so on. Next slide, please. We also thought that the changes or with the self-care is a sign of wisdom, not weakness. To do self-assessment as you think of ways in which you're going to do your self-care. You're going to be self-assessing. Am I doing the right thing? Am I meeting my goals? Am I doing that which I said? So self-assessment becomes important. Or even before I started my self-care and I started to reassess myself, where am I? Where I can even ask my few friends, what do they think? Am I doing the right thing? Is not a sign of weakness. So to do self-assessment. Access assistance. Sometimes maybe we do not want to go to colleagues, to friends, to family members that I'm having this issue, or I would want to improve on this. What do you think? So it's wise. You can ask, look for assistance as you start improving your self-care. Use coping strategies. And there are a number of coping strategies. What we need to see is, are they appropriate? Are they okay for me? Sustain wellness. That I need to know and maintain my wellness is not a sign of, is not weakness. I'm trying to be wise to realize that my wellness has suffered and therefore I need to improve on it. And to know that our needs change throughout our life and career. I could have been very healthy and I kept running up and down, but then at one time I find I'm not fit to do the same. What can I do? What can I change? I used to get a lot of money and this, but now clients have gone. I used to be in this particular gym, but now because of changes, then I need to maybe downgrade from that very, very expensive gym to slightly. It's not a sign of weakness. It means that you assess yourself and realize that the world is changing, and I need also to change so that I'm able to care for myself. Next slide, please. So, what can I do? What is this that I need to do to self-care or care of myself? So The beauty of self-care is that it can take any form. But there are those which are important. For example, having a balanced diet. And we tell others and teach our children we need to eat a balanced diet, and we do, but then the question is that what we do? When we sit down, can we really say that this is not what I teach my children, this is not what I teach my patients, my clients, whoever, this is not what I do. So having a balanced diet, a deliberate effort to have a balanced diet, and we do know what that involves. Engage in physical activities and exercises. And when we engage in these activities, we are saying is not the usual activity of running. It's good if we are managing to do work which help us to move up and down from maybe one floor to the other, dependent on where we're working. But we are saying we have to take deliberate action at the end of whichever, whether it's day or whatever, to be engaged in some exercise. It's even worse when we have to sit down the whole day seeing our clients, our patients, without even getting an opportunity to move up and down. So we have to make deliberate actions that we can do some physical exercises. Where will the time come from? We shall see. Set aside time for yourself. Now, this setting time aside for yourself, sometimes it sounds a little bit heavy. Now, this time I set, if I go and sit in my bedroom, if it's at the end of for 30 minutes, my children will come banging, mommy, daddy, and all that. So you need to take deliberate action to set time for yourself. What time of the day is appropriate, such that you can take these 15 minutes. Some people lock themselves and doze and sit or do something. What you do with your time, you have to set time for yourself, and you need it. Then get social or family support. A number of people have many friends. Something happens, they are able to call their friends, and a number, and they come and they talk to them. So this is not something which you come overnight. It's something which is cultivated. It's something which means that if the people can come to me, then I also have to be there for them. The same with our family members, our family support. But still within our families, you find that there are those others you find they'll be together most of the time. So it's a deliberate action from us, from all of us, that we have friends, that we have these people whom we can rely on, but it's reciprocal, that we also can be there for them. So we have that's another way that these friends, the family support, are not only there to help us, but they also point out, very good friends will point out to us that as you are now, things are not, good friends are not those ones who just be telling us how things are going, things are doing well. But there are those friends who also be able to point to us that these days I've not been seeing you, or these days the way things are, they are not doing so well. We need to, so people who point to us, good thing, congratulate us when we achieve, but also remind us that we are not doing so well, and you feel a little bit uncomfortable, but you'll be grateful to them. So professional growth is also important. And this means that we have, as we set aside time for our physical growth, whatever growth, professional growth becomes important, because the thought that we are not moving, the thought that the one desk I had when maybe I started the clinic 10 years is still this very same desk. I've remained in the same status or this position. This is not going to help in our self-care, because we need to feel good. We need to move. So how can we do that? We can do that by making steps which are going to improve on our profession so that we are able to move. This means when you set aside time to yourself, you could be reading something related or something. So that becomes something very important. It will help us to feel good about ourselves and stop thinking that we stagnated and whatever happened. Next slide, please. We need to take care of our physical health, and this calls for us on things we know, doing medical checkup, annual medical checkup. Because when we know that this is part of taking care of ourselves. I know many of the females, we go pap smears, we go all that. We are able to take care of, we go for medical checkups. And this is important so that we do not get caught by something we said, I wish I had gone earlier, I wish I had seen the doctor. So we need to do our annual medical checkups. Seeking help when in need. Apart from this annual, this one we go because we want to maintain our health. Seeking help when in need. We feel physically unwell. Do we go for checkup? Do we go to see the other doctor? Do we go for tests? Do we go to be checked? Psychological, when we need help, psychological help, we need to go for it. Otherwise, we shall be bursting out on the people who are supposed to be seeing our patients, our friends, our family members. Emotional support. Seek it. We get it. It could be from family members. We need that. We need to be emotionally to feel good. The emotional support or other help that are work related. I'm having this issue, so we need. Whom do you go to? So seeking help when you need is not a sign of weakness. It's a sign of taking care of ourselves, because I wasn't well, I wasn't sure of this, so I need to check so that I become even better. Maintaining a sleep routine and sleeping recommended hours. Now here, so where people say, how many hours? We read the recommended hours. We maintain that routine. I know it's easy these days for people to just go with their phones to fall asleep as they are looking at the WhatsApp, as they are reading many other things. I think we need to find out, is that a recommended way? Can we keep our phones, which are enemies, and be able to say, this is the routine? Does it mean that it's never disrupted? No, it will be disrupted. But most of the times, can we, as much as possible, let us maintain our routine. You can also read a new book of outside your professional work. It could either make you laugh, it could to give you more information so that you know about the world, so that when a debate is there's a debate on this, you can be able to contribute. We are not just thinking of contributing on things on from the medical sphere. When we broaden our environment, our sphere, we become even better. You can also see and listen to Series of Pendua, the older, those older people, as those songs. Just enjoy, sit. It could be under the whatever it would be, but you are just listening to those Series of Pendua, or even take tea with an old friend. So this has some ways of doing self-care, so that at the end we keep feeling, we are feeling good. We try to do as many. Will they be done all of them at the same time? No. Some will be, some might be neglected, but we are making efforts to take care of ourselves. Next slide, please. Next slide. Next slide, please. Next slide. Next slide, please.
I'm just a minute.
Has gone offline.
Yeah.
Okay.
Daktari, Peter has just experienced power blackout, so he'll send the slides to me, then I can project them for you. Yes.
Okay. All right.
If you have them somewhere, then you can just continue, and then when I get there to Tendele.
I'm not able to project because I'm using
Okay, fine. We'll just take a small break, and then we'll continue. No worries.
Although you can continue without sharing the slides, because members will be listening. If you have them on your laptop, even if you're not sharing the slides.
Her laptop had a problem. That's why Peter was projecting.
Okay.
I had a problem of projecting. The Zoom was not working.
The other option, we could just be answering some of the questions or comments or reading comments.
I can.
Okay, it's Dr. Koba. I had wanted probably to just ask Liz Kaimba if she could just introduce herself and just say something about probably the topic for today. Liz, are you still on? Because she had requested to leave earlier due to other engagement. This would be a good point for you to say something. Okay, I doubt she's there. All right.
Hi, I'm here.
Oh, okay. All right. Thank you.
Yes, it's a very important topic today because especially for us as healthcare workers, we ignore self-care so much, because of the nature of our job, because of the passion we have for our job. So I think this topic, we really should listen all those things that Dr. Boyle is suggesting about sleep, about exercise, etc., etc. They're actually very important. So we can, it's timely, especially during this time of COVID, and it is quite necessary. So I think that's all I can say for now, and I have to excuse myself as I'm manning the call center lines for now, and there's some calls coming in. Thank you very much, and good evening.
Thank you, Liz. The presentation is up again, so maybe Doc, you can continue.
Okay. So we go to the 14, that's where I keep. Slide 14.
I'm trying to get there. Just a second. If there's another question, I think maybe we can answer that.
All
as
right.
I get there. Yes.
No problem. Dr. Kwoba, I wish to ambush you a bit with a question that has been sent on the chat. There's this concern from Stephen, who was saying that due to night duties and calls, sometimes it is difficult to sleep at particular time. How can we overcome this?
I think, like Anne Boyle said, self-care doesn't have to take the same format for everyone. And therefore, when you're not at work, because I think the problem is not that your work is shift work. Sometimes the problem is that even when you're off, you really are not off. You are up, and we've seen people who do night shifts, and during the day they have a locum, and when they are done, they are at children's school, and then they try to sleep somewhere at work along the way. So they really don't have time to rest. And if you look at the principles of self-care, it's just having some time to sleep. It's not that it must be 10 p.m. to 6 a.m. It can be 8 a.m. to 3 p.m., but at least you must have some rest. So I think it's tweaking your program to ensure that you budget for your own rest, regardless of how your shift looks like. So that you should not be worried that you're doing our shift work, but when you're off, are you really off? Are you taking time to take care of yourself? Because what happens is when you keep working, even when you should have been off, then you exhaust any resources you have, and then you're irritable, and before you know, you are not as productive. So I think the point is not whether you are shifting, your work is shift, it's whether you're actually budgeting for rest time, regardless of what that time is. Thank you, Gita, back to you.
Thank you, Doc, for that response. And now back to you, Dr. Mbwayo.
Thank you very much. And thank you very much, Dr. Kwoba. It is true that we'll find ways, and all ways of trying to say, I'm not able to do this. But I think the key thing that we started with is that we can find something and time somewhere. That which, and it's been very well explained, that I don't have to be, I do not have to be maybe the time sleeping, but I slept some hours. And that's why we said we do not have to be stressed. We can take any format so long as we are taking care of ourselves, because that which so-and-so does, I sleep from 10 at night, but you are working during the day. So you continue. Thank you very much for that. Another important concept coming up is to keep a gratitude journal. Now, a gratitude journal is finding at the end of the day, whichever the day you be, is that I have something to be thankful for. Could my day have been so bad that I did not even meet somebody who smiled at me, somebody who said thank you to me? So keeping a gratitude journal helps us realize what you have appreciated. It could be small, it could be big. And get a friend. Another important thing is get a friend who walks with you. Let that person lets you know how you are doing. But you have to be open to that person and say, maybe, because their journey might be tough and you want to work with somebody, you might need to work with somebody. And if I'm a beginner, I might get somebody who work and I tell them, hey, I've decided to be doing this. So if they ask me, or I tell them, just keep asking me. At one time I'll be upset, are you asking all the time? But they work with me. They help, they become like a guide. We say that no sleeping after midnight and no sleeping with phones, but so how are we doing? So they guide us, they show us, they annoy us, but they remind us. And then keeping this journal of how you are doing. It's not just the gratitude. How am I doing? If I open mine, can I note that this time I was able to do this time I was able to do this, but at the end of it, when I balance, it could be at the end of the week, when I take my balances, am I able to, among the things that I said, can I put a check? Can I check and I say, this is what I did, this is what I did, and this is what I did not do. And then I go back. Do I get discouraged? Of course, I'm a human being and I'll feel discouraged, but can it be an opportunity to say, this time I'm going to try? Because we said we are not going, it's not a source of stress. So where did I do better than the other area? Next slide, please. Next slide. Are there advantages of self-care? When we engage in self-care practices, a few nice things might come. You learn about yourself. And I learned, yeah, I used to think I can run up and down, just to discover I'm not able to run. Oh God, I have to start afresh. So you learn, it's a journey. You start where you explore, you learn yourself and see. And learning myself means I'm going to look at my weaknesses and start, or that area where I'm not very good at, I improve on it. Maybe I'm not good at doing that which I said I'll do. So I'll need the time now, it's time to improve on it. It will boost your productivity, both at your place of work and at home. That anger, that feeling of, oh, I'm not what, will disappear. So it starts improving on who you are. You even do better now with your friends. They want to be around you. Your family people want to be around you because you're not the stressed and tensed person who is a live wire who just waits to be touched and it breaks. It will enhance your self-esteem, and you're going to maintain good relationship with others because you'll be there, you'll be happy, you'll be radiating happiness, you'll be radiating warmth, and you eat a balanced diet. So you are not going now to, you'll not be looking emaciated and so on. Next slide, please. What can we do? Can we do something a day? When you have not done what you expected to do, start again tomorrow, or that when you remember. And remembering, practice makes perfect. So I said I remembered this in terms of, and when we grew up, and in the village, the people in the village, our mothers used to say the day of getting firewood is the day of getting firewood, the day of market is US market. I'm just trying to translate. So I thought of it in terms of this concept. They knew that maybe today is the day I need to go to the market. And they did not come, when they went many, they did not come back almost immediately. But then they thought that day of getting firewood, which you'd come and pile at home, was it disturbed? Yes, there were disturbances, and there are times they did not do it, and you have to look for those small ones and find ways to make, to start your fire. Did they also take care of themselves? When we remember our parents, our mothers, our grandmothers, those who took care of us. Sunday was an interesting day because they went to church, and this practice still happens. Then they come, they stayed after the service, whatever they did. Then they walked, a number of women, and as they walked, they reached at the gate of somebody. They stood there, then one got in. They continued such that the one who was last, they were last, and they laughed, and think about it, they were taking care of each other. They were taking care of themselves. They loved. They went to the market. They did not come immediately. They were taking care of themselves because at home they have 8 children, 9 children. They have to really do so many hassles and so on. We maybe do not have that opportunity here because of our work, but we can improve ourselves by doing things with friends. When you go to church, you say wherever you go or wherever you go, please, you have time to greet somebody. So practice makes perfect. Next slide, please. In conclusion, and I ask myself, you could ask yourself, what have I not done in the self-care? What is it that is missing? The list is there and we know them, but what is it that we have forgotten? What is it that I do not do? What can I improve on? There's always room for improvement. I started 15 minutes walk. I could do now 20. I might start jogging. I was doing 5 sit-ups. Now I can make them, and so on. What can I improve on? Because every day there's an opportunity to improve. So this is to myself and to you, so that we see how can we improve our self-care. And thank you very much. And Dr. Gitao had mentioned that we are in a study, and this study is on among front health care workers. And you give her the opportunity just to, it's also targeting self-care. So Dr. Gitao, maybe you can say something about that study. The PI is Professor Mathai. So go ahead and say something about the study. Thank you very much.
All right, thank you, Anne, for the good presentation and challenge. What have I done? What can I improve on? And those are thoughts maybe we can reflect on once we leave here. So I wish to just take about 5 minutes or less. And I hope I can be allowed to share, Dr. Haas. I just want to share just
yes,
like
Dr. Ari, please go on.
Thank
you.
Yeah.
All right.
Okay. So there's this study that is going on, and this was thought about when the COVID-19 came to be or came to our country. And the thought behind this study was to look at how telemedicine can be used to offer psychosocial support, especially to the frontline healthcare workers. And the reason behind the telemedicine was because of course, the the chances of getting infected. And so to reduce that, we thought a telemedicine-based approach with the help of would be helpful. So this study is, the PI is Prof. Madai. And the reason I'm happy to talk about this is this study is incorporating the self-care approach. And using this self-care approach, we are doing we have what is called like accountability groups. So healthcare workers, especially from Kenyatta Hospital, from Bagathi, and Kenyatta University Teaching and Referral Hospital, are enrolled, and those who want to participate in it go through quite a process and end up in accountability groups. And in these groups, or the reason behind having accountability groups is it helps you have what we'd call responsible behavior, in that you do what you say you do when you said you do it. So if you have probably decided that part of your self-care would be taking a walk every day, eating a balanced diet, having the gratitude journal. So your accountability friend will be there to find out whether you're doing that, or you can share about that. And then another reason why sharing in groups is important is once you verbalize, you know, verbalizing is one of those powerful tools. So when you share out loud, it's a good way also to, you know, you're also holding yourself accountable for what you're saying, basically. Let me just put it that way. So an accountability partner is allocated to you. And this is a person who coaches another person in terms of helping the other person keep a commitment. And Dr. Anne Boyle has alluded to that. Then the accountability groups are small groups, and they meet online. And some of them, for those who are able to meet offline, they do that. And their goal most of the time is to just have, you know, ensure that you're practicing your self-care, whatever you decided to do. So the group members hold each other accountable for meeting their personal goals. Then our participants' goals will be, are usually towards maybe set academic goals, or, you know, different elements of self-care. And there are tracking forms that they use to look at that. So these accountability groups also bring people together, and it calls out members to speak. Then they also, and then there's a group moderator who now calls out members to speak, so that it's not just one person who is giving, you know, their views or what they have been going through. And also the moderator ensures that they keep time. So much as they are holding groups, they always ensure that time is kept, the rules of accountability are adhered to, and people in the group are all sharing what they are going through. So there are people who prefer to be in groups, but for those who prefer individual, you know, sort of approach, then I'm also glad that we also have the call center, which can accommodate that. Then some of the rules in these accountability groups is unconditional regard for all participants, respect and respecting one another, and of course, confidentiality is very important. And there's also an emphasis on not making critical comments. Then there's asking permissions to suggest options that might work. This could be things that have worked well for others, including revising or lowering the goals maybe you have set, and then changing timelines if that is what will work for you, and gifting yourself when you've been successful. Then something else that another rule is commending everyone for whatever little they have achieved, even if that is as in just participating in the group work. That is something that you're commended for. Then encouraging participants to keep trying and keep coming to group meetings is one of the rules of that engagement. So this is part of an intervention study, and it is going on right now. And as I've mentioned, the target groups are the health workers working in Kenya, Agathi, and Kenyatta University. And the idea is, of course, to manage the stress, anxiety that is coming with this pandemic. And of course, other stressful events that happen in our lives as we are attending to patients, and even in our personal life. So I think that is all I wanted to mention in as far as that is concerned. And yeah, it's just one of the ways that we can incorporate self-care or take care of ourselves as we continue this journey. So now back to the Q&A. I would like to, it's not really a question, it's more or less a comment. And I would like one of the panelists to take this up. I request Rachel Minor was here, but she has left. So I request Jacqueline Anundo. There is a comment here on mindfulness, and Helen is saying, and mindfulness has really become popular in the Western world. There is a free app for Calm Online for a month. It makes you take time and reflect. This can be very good for helping to get things into perspective. So I would like to request Jacqueline Anundo to just make a brief comment on mindfulness. If you can hear me, kindly unmute and respond to that. Jacqueline? Okay. Maybe give her a few moments. So, Dr. Mbwayo, I'll send this question your way. How do you advise on dealing with common stressful events that affect people in the same cycle, e.g. loss of a common friend or loss of a family member?
Come again? How do you help the people?
How do you advise on dealing with common stressful events that affect people in the same cycle? For example, loss of a common friend or loss of a family member.
Okay. So within the same circle, you lose a family member, for example, families, we have friends, and the beauty is that sometimes within the family members, they tend to have different friends. So you might find that some will run to their other extended friends, but also amongst themselves, it would also be good to share how they feel, their thoughts, their feelings. As they share out the feelings, you will find that some are able to get to help the other, because they might be at different levels. And also among the same group, they could also have, they could fall on another relative member it could be an auntie, it could be somebody who could hold them up. So amongst themselves, they could get help from still within the family. They could be siblings, there could be other relatives, they could be aunties, they could be uncles who could also be there of support. They have different friends whom members can go to, and within themselves, as they share what strength does each family member have, so that strength is passed on or helps another member of the family. So there are different ways dependent on what the members are going through. Thank you.
You want me to where? Like this? Like sorry. Kuja nikugonge.
Dr. Super. Dr. Super, kindly.
Hello, Catherine.
Yes.
This is Jacqueline. Sorry, I was not able to unmute.
No problem. Go ahead, please. But you had my question.
Would you kindly repeat it?
Okay. I just wanted you to comment on mindfulness.
Yes.
Yeah. There's a comment on the Q&A where someone, Helen says that mindfulness has become popular in the Western world. There's a free app for Calm Online for a month. It makes you take time and reflect. This can be very good for helping to get things into perspective. So I just wanted to hear your comment, or for you to share your comments on mindfulness.
All right. Okay. Thank you very
Probably
much.
the use of the apps. Yeah. Thank you.
Yeah, thank you very much for that question. Yes, there are different apps that are available for use on mindfulness. And mindfulness basically is a type of meditation in which you focus on being intensely aware of what you are sensing and feeling in the moment without interpretation of judgment. So you find that we normally combine mindfulness with other types of therapies, and it has been found useful in calming people down, especially when you're anxious. So those apps basically have questions that are able to guide you in identifying the feelings that you're experiencing at that moment. And then they also guide you on certain relaxation techniques for body and mind. And this has been found to help reduce stress. And actually there's a structured, there are structured sessions on how to follow mindfulness. There are about 8 or 12 steps that you need to follow on mindfulness. And these are all available online. In terms of it reducing stress, yes, according to research, it has been found that it's very useful and it's very helpful in stress reduction, especially when used in combination, because it's a very short type of therapy. When used in combination with other therapies like therapeutic approaches like CBT and other kinds of therapeutic approaches. I wish we had time or I was to be able to share some of those apps, but I think maybe we can be able to share them even in the next forum. Thank you.
All right, thank you very much, Jacqueline. The next question, I will forward it to Dr. Koba. This is from Benson Gakinya. This is, I believe it's Professor Benson Gakinya. The concern for family need to be considered when making personal schedules. Like you could be an early sleeper, but your spouse is not. How do you go about it? What if the weather interferes with your program? How should you respond? And just a reminder that you are not indispensable at your workplace. Take breaks, and yeah, he's sending us a reminder that we are not indispensable at our workplace. So we take breaks when we should. And then, yeah, maybe he's also saying, what do you think about that? So yeah, many questions in one. Dr. Koba, I hope you got the questions.
Yes, thank you very much.
Thank you.
Thank you, Professor Gakinya, for reminding us that, yes, we need to take breaks because we are not indispensable. And we've seen even prominent figures in the country, someone collapses and before the family even knows that things are happening, someone is appointed to that office. And it's a humble reminder to all of us that if anything happened to you, whether you didn't take lunch and you got ulcers, they're complicated, you will be replaced before you're buried. Very humble reminder. Thank you, Prof, for reminding us that. So it's important that you take time to go to the loo, to eat without feeling guilty. And to the first question about family, I think like Anne Boyle said, when we talk about self-care, it's not cast in stone. So it would be great if you are able to sleep, for example, between 10 and 6 a.m. So that gives you some good 8 hours or something. However, you're also not healthy if your relationship is conflicted. And so being able to adjust so that somehow you fit in your spouse's program, even if it's not consistently, so that you're resting in between, but you're also being able to create time with your spouse, because you could be asleep, fixed on a schedule because she has told us to be regular, but then you're not asleep, you're depressed because then you haven't had time to bond with your spouse who sleeps between midnight and 8 a.m. So I think it's wisdom and it's part of self-care, knowing how to adjust to fit in with the circumstances. And if possible, also communicating with your spouse about where you can meet, whatever adjustments need to be made. Very, very important. And that is the same for children and other things that come our way that really need to be accommodated. Then in terms of the weather, again, things happen. Because Anne made it clear, your self-care, whatever you describe as self-care should not be stressful. And being able to adjust so that if it rains very heavily and you're not able to sleep on time because you are afraid of the rain, you get so distressed because you really must get fixed on a schedule, or if you're going out on a Sunday afternoon and you're fixed that it must be Sunday afternoon and it's rained and you can't leave, then you get stressed. I think that ability to adjust with the times, because it won't always rain, it won't always be muddy, so you can't leave, and you are quickly able to say, so we wanted to go out, but we can't go out. What other things can we do if we are not able to leave? So anticipating these things in life that really we are not in charge of, it's also part of self-care, so that you are not so rigid that it becomes a stressor instead of being help to yourself. I think that's what I'd like to say about that. And thank you. Back to you, Kate.
Okay, thank you very much. So there's 2 comments which I'll read out, and time is not on our side, so we'll be closing up soon. Peter Kamau says, when it comes to exercise, I've found starting with a few workouts in the house and then increasing the physical exercise gradually to be very helpful. Over time, this becomes a positive habit. Thank you for that, Peter. Then there's also another comment from University of Nairobi. I don't know who that is. I have enjoyed this session. I'm a medical student and I started self-care late last year. For me, it looks like reading books and researching to try understand my thoughts and feelings, because I realized I'm not the best at emotional intelligence. I also practice daily affirmation, especially on gratitude, and that really does elevate the mood. So thank you very much for those comments. And then there's a concern again from Patrick Nguru, who says, I'm concerned that a number of healthcare workers have poor eating habits. A number of them do not have a balanced diet. So I think I'll throw this to Dr. Mbwayo. I have also been a victim of that. Sometimes you're so busy running from one clinic to the next, or, you know, just up and about, and you just probably grab something in between, probably not a really balanced diet. I don't know. Maybe you can give us your comments on that, Dr. Mbwayo.
Thank you very much, Dr. Getao, because I can see a number of us are victims of this. But I think one of the things we are told is to eat healthy. And for us to be productive, we've got to make an effort to try and get at least a good meal somewhere along the way, because is it one, do I then need to make it? Is it be the breakfast? Would it be the time when I can be able to sit and have a balanced diet? In between, sometimes, as we've kept saying, that some things, they will come. It doesn't matter. As I said, even that day, the women were always going to get firewood. It did not work. There are times there were disruptions. So the point is, as you keep your journal, how frequently are you disrupting your meals? How frequently are you not able to do that? I think that then calls for, what can I do? Where do I need to start improving on? Thank you. That would be my response to that.
Okay. Thank you very much. I think we shall end the Q&A now. I could ask for a comment or two from Dr. Somba. If you have a comment on the presentation and the topic itself.
Yeah, thank you very much, moderator. Good evening, everyone, and I hope we are all keeping safe. I think it's a beautiful presentation, because one of the problems that medical people have, they feel they are infallible or superhuman. Sometimes they're not too late, they're just human like everybody else. And therefore, I think the self-care topic was very timely, and I hope we all got it and we understand it very well. Just a few comments that I've missed out. Insurance. We must have an insurance as well, because you might not realize that medical treatment is very, very expensive until you get there. What you are giving sometimes we can't even afford. So as we take care of ourselves with other activities, let us have some medical insurance that be able to cover us in case we get in some problem. One motto, there's a motto in a school which says, Yishinde ushinde. The biggest enemy of ourselves is actually yourself. Yishinde ushinde. You must create some space for yourself. It is very, very crucial. Some people are very much afraid of their own company. Create some space, as somebody say, even is 10 minutes or 10 minutes, you stay alone and you talk to yourself and reward yourself and also rebuke yourself. We think you have not done things very well. Also, talk to yourself and say, Bana, can you do something? If what you did today was not good, and therefore tomorrow I expect to do something better. You're talking to yourself. And then when tomorrow comes, then you correct some of those mistakes. At the end of the day, then you understand things very well and keep touch with your old friends, especially the friends who are that we are together in primary school or secondary school if they're still there. I know there are WhatsApp like schools where people went, Alliance and other schools. Get in touch with them and just talk about the old days and laugh and laugh and laugh. That will actually get you in a better mood. And they also realize we're just human and we are all infallible. We are all human. And at the end of the day, the question is, what have you done for yourself? Not what have you done for other people, but yourself. So I want to thank you, all the speakers, and I think today I've gained a lot, and I'm very grateful. Thank you very much, and have a good night. San.
Okay, thank you very much, Dr. Somba. I will ask Dr. Kigondu if you have a comment.
Yeah, thank you very much to the team. I think I've learned a lot. The last 3 slides on self-care, I think we are the people as gynecologists who don't sleep, who don't eat. And we need to start doing exactly that. And I think these psychological webinars have been very useful, especially to us. I think on the screen there, you have our clinical webinar for Thursday. And this Thursday, we will be having Dr. Supa Tunje, who is our very own Treasurer General, but she's also a pediatrician. She will be discussing COVID-19 and pediatrics from 2 p.m. on Thursday. This is in relation to the school opening, because our biggest fear for school opening and COVID, I think she'll touch on that. So we welcome all of you to that particular CME.
Okay. Thank you, Dr. Kigondu. So as we end, I would just emphasize on what maybe Dr. Nguru Patrick was, I'm assuming that he meant to say that ceasing smoking, alcohol intake could help. Yeah, that's what you were saying. So if those are maybe using cigarette smoking or alcohol are some of the coping mechanisms that you're using to deal with stress, I would urge that you look for alternative methods of managing stress and try and practice self-care. Start small, as Anne has said. You don't have to try everything at the same time. Just one at a time and stay motivated. Look for an accountability friend or an accountability partner who can walk this journey with you. It may not be easy initially, but with time, of course, then you are able to incorporate quite a number of these ideas. So I will ask Dr. Joy, I keep seeing her coming in and out to, okay, she's out again. So maybe Supa Tunje can close for us the meeting. And thank you very much, the panelists and our presenter.
Thank you very much, Gitao. And to our presenter, Dr. Boyle, that was a very nice presentation. And personally, I think I like a lot of this self-care, because dealing with children, sometimes you can get overwhelmed. And I know most of the time it's the concern about, you have very sick ones and you get all worked up during the day. But This is timely, especially as the year begins. And I believe most of us usually look forward to a greater year. I believe with this such guidelines, I think 2021 should be greater than the previous years. So thank you very much for everybody and all the panelists and to the listeners. We look forward to more sessions in the coming week. Thank you.
All right. Thank you very much. And have a good evening.
Thank you very much and have a good evening. Thank you.
Thank you.